small towns across America, residents rely on family medical practices. But what happens when those practices are gone? Well, News 18 decided to find out, and in part one of our Hometown Healthcare series, I sit down with Dr. Joseph Furr, a doctor whose practice was ripped out of a small town, leaving uncertainties behind. For more than 60 years, this quaint building in Hillsboro has been known as the family practice of Dr. Jack Furr and more recently, his son, Dr. Joseph Furr. But in March, that all changed.
In March, though, it fell apart, quickly. And for reasons that I'm suspicious of, just like it did not have to go the way it went.
Furr's story began long before March. Joseph attended Ball State University before heading on to medical school at Indiana University. After graduating in 2005, he came back to his hometown of Hillsboro to work alongside his father here at their office on Main Street.
And I got to work with my dad for 1 year before he got sick and passed away within the year. So then it just became mine by default after that. And of course, this is some of my favorite pictures ever. Just all of us in the family, the town knew us pretty well, actually, just all of us little redhead kids running around. He taught me a lot. He definitely said, you can do a lot with what they've taught you. Don't be afraid.
But in January of 2011, Furr says fear started to set in. And before long, he found himself searching for support from a bigger corporation.
And as the bureaucratic or the paperwork became very big, you realize I might need help. I just might need people help manage, run it, and whatever.
After more than a year of talks, Furr entered into a contract with the Franciscan St. Elizabeth Network. With this new contract, Furr became affiliated with the network, but was able to still practice in the town he loved so dearly. But what Furr didn't know was that 3-year contract he signed would only last 1 year. How did it actually all come about?
Letter in the mail. Got it. I got it on a Tuesday. I remember just my mom was like, Joe, you should come down and read this. It was done.
In the letter, hospital officials told Furr the contract had been severed, but didn't give him a reason why. Furr says the building is owned by his family, meaning the family could keep it. But it was what was inside the building that Furr says was most precious and now no longer belonged to him.
At that point, all the patients that I would call mine at one time are theirs. So I didn't know what to do.
Furr began by typing up a letter to his patients, which he posted outside of his office the day he was notified. For 2 months, that's where those letters have stayed. Furr hadn't been to his office since that day in March.
And this is now July, so it's a long time to be twiddling your thumbs when you wish you weren't.
But on a hot, sticky day in July, that's where he agreed to meet us, giving us a tour of what was once a part of his daily life.
This is where I did most of my thinking, right here. I'd come out and I'd talk to Cammie about usually whatever little problem I had going on, and we almost always ended up having an answer for somebody somehow.
But an answer for himself is something Furr says he just doesn't have.
It just didn't have to be this way. That's about all I got to say about that.
And tomorrow, in part 2 of our Hometown Healthcare series, we continue our journey with Dr. Furr to see what's next for not only him, but his practice. And we also sit down with St. Elizabeth health officials to ask why this is happening and find out if hometown healthcare could one day be a thing of the past.